When we talk about expanding health coverage and making health insurance more affordable, one of the main places we need to do that is with small businesses. That's a real problem because most people who are working and uninsured work for small businesses. Small businesses want to offer health insurance, but they just can't seem to afford the ever-increasing cost of coverage. Senator Josh Stein has a proposal in the North Carolina General Assembly right now that would combat this problem. We went and talked to him last week. Let's see what he had to say.
The majority of people in North Carolina who don't have health insurance, and far and away the majority of people who are underinsured, are people who work in small businesses. And it's not because their employers don't want to offer it to them. It's that it's cost prohibitive. They cannot afford the benefit for their employees. So the bill I introduced for small business health care does two things. One is it increases an existing tax credit, which is currently at $250 per employee, to $400.
But a tax credit for small businesses isn't the only thing in Senator Stein's small business healthcare proposal. He also proposes a really innovative program designed to get healthcare coverage, affordable healthcare coverage for small businesses at about 30% less cost than they normally pay. Let's hear what he has to say about that.
The second thing it does, which is more innovative, is it creates a publicly financed reinsurance pool where private insurers can then lower by as much as 30% what the small business healthcare premium would be, because of this reinsurance pool would be there to help essentially subsidize the cost of small business health insurance. And the hope is that it would open up access to tens of thousands of North Carolinians who currently don't have health insurance.
So in the end, we need to do two things. The first is what Senator Stein's bill last week that we talked about is covering. That's to control healthcare costs. His idea is to use this comparative effectiveness research to really focus our healthcare dollars on what works and not pay for what doesn't. Then we need to expand coverage. We're going to have to do that through a combination of public programs and programs like Senator Stein's proposing here. Tax credits for small businesses and some sort of subsidy for small businesses where they can buy a health plan for themselves and their employees that they can actually afford. Senator Stein is really on the forefront of thinking about health care reform in this General Assembly,